There are many aspects and options when it comes to having cosmetic breast surgery. Board-certified surgeon in plastic and reconstructive surgery, Dr. Bruce Landon, is back to break it all down for us. Welcome back, Dr. Landon. How have you been?
Thank you very much for having me. I've been great.
Good. Well, we enjoy when you're here because it's very informative, and you know, cosmetic surgery, you tend to go one way when you think of cosmetic surgery, and that is usually breast augmentation. And you say that that's still the most popular request that you have at your practice?
It is. I think it's probably the most common call to the office is for some aspect of breast surgery, whether it's augmentation, reduction, breast lift, or some combination thereof.
And when people are thinking about doing, let's use breast augmentation first, you say the choices out there are endless, and you really need to find out what the patient wants and kind of rely on your expertise, right?
I think it's really difficult to be a consumer of plastic surgical services nowadays, only because the more consults one goes to seek out the right procedure, the more different opinions they're going to get. So there's an element of confusion that just follows patients from facility to facility. In addition, most of us, including myself, we go to Google for a lot of our medical information, and they're bombarded with a lot of information that's very difficult to kind of synthesize all the different options and determine, hey, what's best for me? And that's where the consultation time is so incredibly important, so that we can let them know what the different types of implants are designed to pull off, because that's essentially why there are different types of implants. It helps us get the edge on enhancing those unique features of this person's anatomy versus this person's anatomy.
It's really customizable, if you will. And I know you've brought some examples, and yeah. I mean, to me, they all look the same, but I know that's not the case, right,
yeah.
Dr. Landon?
And they do look the same when you just see them sitting on the table. I mean, just quickly, the difference between these are silicone gel implants, probably the most popular products on the market. But depending upon the individual patient, whether they have a lot of their own natural breast tissue versus very little breast tissue, they could be a gastric bypass patient who lost a tremendous amount of weight and they lose a tremendous amount of their breast volume. Some of these implants are more ideally suited to enhance some of their natural features versus others. If you hold up these implants and you look at them from a side view, you can see that there's a lot of deformity of the implant surface that can actually be visible with certain patients' anatomic features. And as you up through your implant line, you'll see that some of the gels are considerably thicker, so they resist some of the natural deformity, and these are the kinds of things that are ideally suited for people with a very thin skin envelope. But there's a host of options out there, all of which are super important that we go through the patient so that we meet, number one, we understand what their expectations for outcome are, and two, that we get as close as possible to those expectations.
And you brought up the consultation, and that's where you're able to customize, if you will, what the treatment is. What do you want people out there to know? Say they've always kind of thought about it in the back of their mind, but they've actually never had the courage, if you will, or the, the need to actually pick up the phone. Why is now a good time?
You know, come to my office, and it's a chat.
Yeah.
You know, I hope that from the minute you enter our office door, it's a pleasant experience. When you leave, I think that you leave better educated than anybody else out there about the prospective procedure that you might be thinking about. Because my whole intention during the time of that consultation is to get to know what the individual would like to have as a result of their surgery, and make sure that we're as close to getting them to that result as we possibly can. And education is the only way that they're going to get there.
Dr. Landon, thank you for coming in, talking about this. And again, if you are interested, now is not only a good time because you get the great consultation that Dr. Landon was talking about, but also you can get a great price. As a matter of fact, $4,899 right now if you call, but you got to mention the Morning Blend if you do so. There's the website. There's his phone number. Again, 2 locations in the Bay Area. Dr. Landon, thank you so much for coming in.
Thank you.